Hello, Jim Kinney here with the RepublicanandMassLive.com. I'm in Holyoke, Massachusetts today. We're here at a Massachusetts Nurses Association informational picket, protesting recent job cuts here at Providence Behavioral Health in Holyoke. These unions here, it's the Massachusetts Nurses Association and it's the United Auto Workers. A few weeks ago, about 15 nurses had their jobs impacted. 10 jobs were lost, but after everybody got done bumping and that sort of thing, 15 nurses were affected, and about 17 UAW workers, there's counselors here, lost their jobs. There was an unnamed number of supervisors and other people who lost jobs. The people who run this place, Trinity Health New England, say that it has to do with money. There's not enough money available to pay for these sorts of mental health services that are available here, so they had to make the cuts. There's also in an older building that the needs are great for physical improvements. The union says Trinity Health New England's making billions in profits, according to a most recent state-sponsored study. Why not reinvest that money here? This facility has the only pediatric inpatient psychiatric unit in Western Massachusetts. The next nearest ones are in Manchester, Connecticut, or in Brattleboro, Vermont. And the state's also shown studies that young people, that adolescents and children who present with psychiatric conditions at a not a nursing home, but an emergency room. So young people who present with psychiatric problems, suicidal ideation, that type of thing, at an emergency room, tend to languish there for days or more, waiting for a bed at a specialized location like this. The need is great, the funding just is not there, according to management. These nurses say, reinvest some of your profits here because the need is so great. And they're trying to protect their jobs. The management here stopped using 12 beds, 12 of the 24 beds that they had in the adolescent and children's inpatient psychiatric unit. They stopped using those beds back in April. They never officially closed them, because officially closing them means that you would have to have a hearing and all that sort of formalized process. They just, doors closed, they laid off the staff. Their guess is that nobody's ever going to come back. But we've got about 20 people here on Route 5, which is Main Street in this part of Holyoke, just a little bit north of the West Springfield border. And we're doing a protest across the street from Providence Behavioral Health. If any of you have any questions, feel free to type them here in the comments and I'll answer them.
On the Cape. I saw him at a retirement thing for Dan Clifton.
And then the other thing that has the
Cindy. Yes. Jim Kinney here with the RepublicanandMassLive.com. I'm doing a live Facebook Live video. I was wondering if you could introduce yourself to the people here and tell them who you are and what you're doing.
My name is Cindy Chaplin. I work at Providence Hospital. I've been here for 40 years. We're out here today to raise awareness about the cuts that were recently done to our elder unit and our children's unit. They cut staff in both places, as well as availability of beds in our children's unit. And they serve the most vulnerable patients of all the mental health clients that we have. We're hoping here today that we're making the community aware of the needs for these beds to be restored. There are sometimes wait times in the emergency room for children up to 4 days because there's no availability. We're the only hospital in Western Mass that has a children's unit, so people come from all over.
What was the impact of the cuts on the way you folks do your jobs?
So the nurses on the elder unit especially, they were cut just in staffing, not in bed size. And so they really have, their quality of care is going to decrease because they just don't have the resources to take care of all the needs of all the patients. They have 16 patients on their unit and they downsized to 2 nurses. And these patients have a lot of medical needs and they're usually compromised with Alzheimer's, so they need a lot of physical care also.
Because when you say the older unit, you mean older in terms of the people there?
The age, yes. It's anyone 65 and older.
And what's happening on the children's unit?
And the children's unit used to be a 24-bed unit with adolescents on one side and children younger than 13 on the other. They've now made one unit, which is 12, with the blended children. But you can't have adolescents and little kids together in groups and things for programming. And they cut the staff on that side to be only one counselor for the older kids and one counselor for the younger kids. So there's really not a lot of program. They cut the occupational therapist, which she did a lot of programming for these children to help them get back into the community. And without that support, these children have a slower progress in getting better.
And these are very troubled youngsters. What kinds of diagnoses do we see in that?
So we can see anything from schizophrenia to complex PTSD to depression to autism, anybody on the autistic spectrum. There's a wide variety of things. And a lot of these children have been severely abused and neglected, and they come to us hoping that we can help them. And when you have enough staff, you can help anyone.
Now, what's your message to the folks at Trinity, the management here?
So we're hoping that they restore our nursing levels on our older adult unit, and hopefully we can open our beds on our children unit. They say it's temporary, but they had this major layoff, so it doesn't seem temporary. And we're hoping that Trinity, they made $1.3 billion last year in profit, can reinvest in our particular institution a little more, since we serve the most vulnerable patients in all of Western Mass.
And that's what the message here is with Fat Cat, the balloon behind you, correct?
Yes, yes. You know, 1.3 billion. If you looked at every other hospital around this area, they were in the millions of profit. But Trinity, being so large, was 1.3 billion, and we are supposed to be nonprofit, so hopefully that will get reinvested into programming for our children and elders.
Thank you very, very much for your time. I'll let you get back to it.
Thank you.
Thank you. So once again, Jim Kinney here with the Republican and MassLive.com. I'm here at a protest march, informational picket, I think is the word they use. Sponsored by the Mass Nurses Association. It's a union here that represents workers at Providence Behavioral Health here in Holyoke on Route 5. They suffered some job cuts. About 15 nurses were impacted, about 10 jobs lost by the time people got done bumping and all that sort of thing. There was 15 nurses impacted. About 17 UAW, United Auto Workers members who work as counselors here lost jobs as well. And then there's an unsaid number of people, management positions, that type of thing. And as just heard Cindy explain, this is a place that serves really vulnerable people. Two of the units hit were a unit for seniors who also have psychiatric diagnoses, and children who are very, very ill. So both those groups are here, and both those groups need a lot of help. The problem is there's not a lot of money out there to pay for that type of stuff. So the reimbursements are not great. We're talking about a lot of people on Mass Health, a lot of people who are hurting and can't afford the kind of care that they need to get back and reintegrate with society. So subsequently, the hospital doesn't get paid for doing that work, loses money on it. And they say they're also under a lot of financial pressure because it's a very old building that needs a lot of work on it. So if anybody has questions, they'd like to throw questions at me, feel free to do that here in the comments and I can help you out. I should mention this on behalf of Trinity, which also has Mercy Medical Center in Springfield. They sent out a letter talking about access to the facility. If you have an appointment at Providence Behavioral Health this afternoon, don't worry about this. We're across the street here in the little nature park that's run by it's the Land of Providence Nature Park. It's run by the trustees of reservations. We're not on hospital property. Nobody's in this little turnaround here, the jug handle. There is hospital security on site here. And here we have Fat Cat, who's been a staple of these union protests over the years. They had to weigh him down good because he's kind of close to this barbed wire, and that would be bad for Fat Cat. A little deflating experience for him. So I just gave you a little bit of a walk through the protest here. Once again, Jim Kinney with the Republican and MassLive.com here at an ongoing protest hosted by the Mass Nurses Association here at Providence Behavioral Health in Holyoke. Protesting some recent job cuts and some recent cuts in staffing. Cuts that the nurses say have hit hard. 2 units, one that provides care to older people, senior citizens with mental health issues, and one that provides help to children with mental health issues, psychiatric diagnoses. And this is the only children's unit available in the region. I'm just doing Facebook Live. But yeah, once again, Jim Kinney with the Republican Mass Live here. I'm here with some nurses from the Mass Nurses Association and some union members from the UAW local as well. And we're at a protest of some recent job cuts announced by Trinity Health New England here at Providence Behavioral Health. And we've got about 2 dozen, maybe 3 dozen people. A lot of them have to go to work later on. And Fat Cat is here. They're sort of a union protest statement. How are you? So I'm probably going to get in copyright trouble from Twisted Sister here because we've got some music coming in. So I'm looking forward to my letter from the Twisted Sister people. So I'm going to move you a little along here because I don't have the D. Snyder's permission to use that song in my Facebook Live. You know what I'm saying, guys? So once again, Jim Kinney here with the RepublicanMassLive.com, coming at you live from a union protest. This is the Mass Nurses Association. It's the United Auto Workers, and they're protesting recent job cuts here at Providence Behavioral Health in Holyoke. Former and current staff members have been telling me about the impacts of the cuts. 17 UAW members who are the counselors, and about 15 nurses lost jobs. In addition to that, a number of people who had jobs in management. The folks who own and run the hospital, Trinity Health New England, they also have Mercy in Springfield, say their hands were tied, that there's just not funding coming in for insurance providers and for the government to provide the care that they do here. So, and they're also hamstrung by having an old building that has real demands for capital improvements. So it's hard to do that. These nurses are saying, you know, you made $1.3 billion in profit last year. Why not reinvest some of it here? The 2 units that were hard hit, one is a residential inpatient unit for older adults, senior citizens, with psychiatric problems, and another unit is for kids. Sadly, kids suffering from stuff like schizophrenia, suicidal ideations, PTSD, real serious diagnoses. This is the only children's and adolescent psychiatric unit, inpatient unit, available in Western Mass, in Worcester, Camden, Hampshire, Franklin, Berkshire County. The next nearest ones are, you got to go north to Brattleboro, Vermont, or you got to go south into Manchester, Connecticut. And state studies have shown that kids can languish in emergency rooms. You have a child, a young person in crisis, is taken to the emergency room, and they could be stuck there in a small room, not getting the help they need. Being kept safe, but not getting the help they need. One of the other things that these nurses have told me is that with the cut of some counselors, there's really not time, and people do extra things like the occupational therapy, art therapies. All those things are going to help these kids, you know, get back to a point where they can reintegrate into society. Because that's the goal, right? That's the goal everybody has, to get these kids healthy and get them school, work, life.
If you work 3 to 11, 11 to 7, or if you work 11 to 7, then 11. So it's 11 A to 7:30. It's got to be. Yeah. It's
this book is already so depressing. We need these people. Yeah, it's a depressing case all the way around. One of the nurses earlier who talked with me explained part of it's just the problem of funding for these services. There isn't the insurance money available for the psychiatric services that there is available for if you needed a knee or a hip replaced. If I could grab somebody from UAW. Hi, I'm Jim Kinney. I'm with the Republican and MassLive.com. Could you introduce yourself and tell me what brings you out today and what you do here?
I'm Scott Hayden. I work on the older adult unit as a mental health counselor, and I'm here to support my colleagues, mental health counselors, nurses, and others who have lost their jobs or had their hours cut or in some way been affected by these cuts by Trinity Health.
And what's been the impact inside?
The impact has been a lack of quality of patient care that we've been able to give over the years, that I've been very proud to give over the years, and we're not able to do that. On my particular shift, my unit, we went from 3 nurses to 2. And so that's really greatly affecting the care that these patients get.
Because they need care to do everyday basic things.
They need care for ambulating and showering and sometimes eating. There's other medical issues, diabetes and skin integrity issues, etc., that they need assistance with. And without that 3rd nurse, it's a lot more difficult to get that done.
3 nurses, how many patients?
16, up to 16.
Yeah. Okay. Thank you. Thank you very much.
Thank you.
So you heard from Scott there. Just kind of explained to you what's on the inside. Just so you folks know, I talk to these people ahead of time before I do the interview, before I do the live video. I set up the interviews. But I don't tell them what to say or anything. I just tell them who I am and what I'm going to be doing. So nobody's shocked or anything. Well, Jim Kinney here with the Republican and MassLive.com. I'm about to wrap up the Facebook Live video here from the protest here at Providence Behavioral Health in Holyoke. It's 2 unions. It's United Auto Workers and the Masters Association protesting recent job cuts. A number of nurses are going now because their shifts start, so they got to go in and get to work. So once again, Jim Kinney here with the Republican and MassLive. I'm going to sign off the video now. Feel free to check back on MassLive.com and in tomorrow morning's paper. If you're a home subscriber, it'll be on your doorstep. If you're not, you should be. And if you're not, you can always pick it up at the newsstand. Thank you.